Meanwhile, I got on the red state train today, and I couldn't get off. I've been socially engineered by my email. I saw this piece on Red State. Obamacare, destroying lives, killing businesses. Last week, we asked for your personal Obamacare horror stories. More and more middle-class families are forced to surrender their dignity and grovel before the government for their health insurance. Please, sir, may I have a government-created website so that I could buy personal insurance? Sir, please. Here's the latest from Charles in Alabama. Well, I'm a 53-year-old self-employed real estate agent. I don't know if that's the way that Charles talks, but...
After placing his fiddle down.
He goes on to talk about how he pays for his real estate business with his wife. We have 2 sons who are approaching college age and both plan to attend the state public universities. Hey, what? I want the government to get their boot off of my neck. Financing state public university. Oh, no, he doesn't write that. He says, where the average 4-year cost has been estimated at over $100,000. That's an expensive public university. I definitely, if this letter is about we need to fund our public universities in the way that we used to, I'm all for it, but that he doesn't say. I work 7 days a week. Apparently, he works during the Sabbath or Shabbat. I want to be fair. I only attempt to take a day off. I work at least 10 hours a day, but it's not unusual for me to work. Okay, I've been blessed with great health, as been my wife and our 2 boys. He doesn't mention how his 2 young boys, who are now college age, can continue on his family's plan in a way they couldn't have a couple of years ago until age 26. Maybe he's not aware of that. I have struggled to pay $735 a month to Blue Cross Blue Shield for health care insurance for my family. But I'm a believer that it's important to guard against catastrophe. And I've paid that large amount completely out of pocket ever since going into business for myself. That means I write a personal check for the entire amount every month. We received our Affordable Care Act letter from Blue Cross Blue Shield this week. Well, that's a lie, number one. No, it's just a letter from Blue Cross Blue Shield. It's not actually an Affordable Care letter. We were informed that our new monthly premium starting January 1 for the much reduced benefits will rise from $735 to $1,114 with our yearly deductible tripling. This monthly premium is more than my house payment. Upon further investigation, we have found that for our benefits to stay the same as they are today, our premium would be about $1,600 a month. The cheapest alternative for us in an ACA compliant policy is $870 a month with a yearly deductible of $12,700. Now, here I'm going to stop for a moment and say we don't know what this guy's income is. Without knowing this, it's very hard to really determine what he's talking about. But there's a story in Talking Points Memo starting to look into these letters from insurance companies. Now, this guy is 53 years old. In Talking Points Memo, and I'll get back to Dan from Alabama, or Charles from Alabama in a moment. Donna received a letter canceling her insurance plan on September 16th. Her insurance company, Lifewise of Washington, which is a Blue Cross Blue Shield subsidiary, had told her they had identified a new plan for her. If she did nothing, she'd be covered. She's 56 years old with a 57-year-old husband and a 15-year-old daughter. She'd be paying an additional $300 a month for coverage. The letter made no mention of the health insurance marketplace that would soon open in Washington, where she could shop for competitive plans. It just said, if you do nothing, we'll roll you into this new plan. If she had done nothing, she'd end up spending about $1,000 more a month for insurance. Donna, after finally going on to the exchange, said the info we were sent by Lifewise was totally bogus. Why did they try to screw us? People who are afraid of the Affordable Care Act should be much more afraid of the insurance companies who exploit their fear and overcharge them. Well, surprise, surprise.
Surprise.
This is their business model, and it's always been their business model. Turns out that Donna could go on the exchange, and instead of paying her $724 monthly premium for a $10,000 deductible, she could go on to find another Lifewise plan on the exchange with the same deductible they offered her outside the exchange was cheaper. Plans with a lower deductible had the same or lower premiums than the Lifewise plan. So there were other companies doing better job. She ended up getting a Community Health Plan of Washington with a $250 deductible. And on top of that, she qualifies for a federal tax subsidy that would knock her monthly premium to $80. Her daughter could enroll in Medicaid at no cost to the family. Now, this is just an anecdote. They found other instances in this piece about insurance companies upselling. But getting back to Charles in Alabama, he's talking about a $400 increase a month with his yearly deductible tripling. Now, I went on the Kaiser Foundation subsidy calculator. We don't know how much Charles makes, but I put in a family of four making $75,000 a year in Alabama. And I think you're doing pretty good in Alabama at $75,000. You're not doing great. And if you got two kids going to college, you're certainly struggling, without a doubt. But according to this, a silver plan would be $8,000 a year. You would receive almost another $800 in subsidies. So you're paying $7,125 a year for a silver plan, which caps your out-of-pocket costs at $12,000. Now, I don't know what his yearly deductible was. He doesn't actually get into the specifics here. But I tend to think that something's amiss in Alabama. Unless this guy is making a lot more cash and something's going on in the exchanges that I don't understand. Because you can still go in and you could still get that silver plan for less, for $50 more a month than he was paying. And I imagine the deductible is lower, but it's hard to know without the thing. But this is going on across the country. A bunch of anecdotes which seem to have no relationship to the truth. Now, we expect this out of Red State, and don't expect Red State to actually dig into this. But it seems to me that if you are CNN, or you are USA Today, or you are NBC, that you should be doing just a little bit more reporting before you just tell these stories. there's no doubt that about 5% of the population who are enrolled in private health insurance are going to end up paying more now. But presuming these people are going to age, they're going to end up paying less than they would have otherwise. And that's simply the nature of insurance, of risk pools. That's just the way it works. So when Obama said that every single person can stay in their plan without a problem, he was, one, not telling the full truth, lying. Two, underestimating how bad the insurance companies were, or in terms of their practicing capitalism, I guess. And three, telling the truth to 95% of the people who are buying individual insurance. So, I don't know. I still think that we could have, we would have had probably a lot more crowing, but a lot more happy people if we had just gone to single payer. And hopefully that's where we get. But this is what happens when you use the market to prop up an industry which has made their money on lying to consumers, on selling them shoddy products, and just simply betting. I mean, that's what the insurance model is. We're going to sell all the people a crappy product. And because of the nature of who gets sick and how many people get sick, most people won't really realize it. But when they do, they're thoroughly screwed. That was the insurance model for a long time. Now it's just basically getting subsidies from the government.